to observe members as they participate in the debate and during the votes. Members and staff, please keep your microphones on mute unless you need to answer a question or speak. Members, if you wish to speak, you can have your video on, and if you do have that on, then please, and if you are able to, please raise your hand or unmute your microphone and let me know, and I will create a speakers list. When voting, if you can, have your video on, and if you are able to, raise your hand or unmute your mic to indicate your vote. Members, if you have any motions, you can submit them in writing to the clerk. The clerk staff are available by email at taac@toronto.ca. Although we are meeting remotely, the Toronto Accessibility Advisory Committee acknowledges the land that we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people. And Toronto is now home to many diverse First Nations, Inuit, Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Members, I would like to ask at this point in time, are there any members with declarations of interest under the Municipal Conflict of Interest Act? And if you do have an interest, please raise your hand or unmute your mic. Seeing none, we can proceed. We have one item on the agenda, and since this is a special meeting, there will be no new business or additional items. Item number 1, Rebuild and Recovery Plan for the City of Toronto. Members, this meeting was called to allow the committees to continue discussion on the plans for Toronto's post-COVID-19 recovery with senior officials from the Toronto Office of Recovery and Rebuild. To assist us in preparing for the meeting, the TORR office provided some questions and a discussion guide. I also circulated some additional questions. I believe we have several staff in attendance to answer those questions. Saad Rafi, the Chief Recovery and Rebuild Officer, and he is supported and joined today by Mark Kim and Ryan Glenn. Because we have already seen the initial presentation from our last TAC meeting, unless there are any members who are asking for that presentation again, I would suggest that we proceed right into the discussion, which I believe we can do. If I can just get the screen to see if there's any members who need to have clarifications from the presentation provided at the last meeting. And just as a reminder, you would have received that presentation at our last meeting as well. So you would have a hard copy of it, and you also have received the presentation via web conferencing. Seeing no indication, I think that we can proceed to answering the questions or perhaps asking questions of staff before we proceed. Are there any members who have questions of the staff before we proceed to provide some comments and to answer the questions that they have provided to us? Okay, seeing none, thank you. Then what I'd like to do is go to question number 1, and simply because we're taking this opportunity to do a deeper dive to answer these questions specifically, what I'd like to do is read the question out loud, and if members have particular comments that they would like to provide, please indicate by raising your hand if you're able to, or unmuting your microphone. So these are questions provided by way of the discussion guide from the Toronto Office of Recovery and Rebuild. The first question is, what are the 2 to 3 greatest challenges your business sector community is facing today? That's the first question. And I should note that the questions are grouped under 2 categories, recovery followed by rebuild. So just to repeat, what are the 2 to 3 greatest challenges your business sector community is facing today? And the questions are also on the screen. Thank you very much, clerks. That's very helpful. Who would like to proceed to answer and provide your feedback? I don't have everybody on my screen. Okay, so I want to just start by acknowledging Wendy. You don't have access to a timer, but I do have a timer. Just to keep order, I will start your clock. You'll have 5 minutes as you generally would, and I'll let you know 30 minutes before the end of 5 minutes. That is your time. Okay? Thanks, Wendy. Go ahead, please.
Councillor, I wonder if I could just ask a clarifying question before we begin answering these questions. So is the intention then for us as a group to work through the questions that are listed in the various discussion guides, and then what is to be done with that feedback? What happens in terms of next steps here?
Thank you for that question. I think that your question is primarily directed at Saad Rafi and his team. Saad, would you like to respond to Wendy's question?
Sure, thank you, Chair. This is part of our overall engagement, so that information will be taken in, and we're compiling all the feedback across various themes that we outlined in the report. There are 7 of those themes. The sort of raw inputs, if I can call them that, will also be posted on toronto.ca/open, so everybody will be able to see what kind of feedback we received, not by way of attribution, of course. But this is part of our outreach to take in the findings, analyze them. Then we will develop recommendations with Dr. Mowat and myself and submit those to the city manager. Hopefully early September.
Saad, thank you very much for your reply. Does that help you, Wendy, on where this information is going after it's been gathered? Okay, thank you.
Yeah, I think that clears it up.
Okay, so do you want to still proceed with your feedback then, since you already have the floor?
Sure.
Okay, go ahead, please.
Yes, I think I would. Thank you. So it's hard for me to say that there are only 2 to 3 great challenges for our community, is because, you know, when we were discussing this at the last meeting, I think many folks have said, and certainly it's the way that I feel in terms of the folks that I work with in the community, that people are still very much responding to this as a crisis. So some of the reasons why I think are related to these challenges. One of the first ones I wanted to mention is the lack of vulnerable status within this and other response plans related to COVID. So as I discussed at the last meeting, and I just want to raise it here again, what I have seen in terms of the work that I do with the province of Ontario, and also initiatives around the federal government's response, is that there are a number of decision-making bodies that have been set up. There's a command table, for example, at the provincial level, and people with disabilities have not had status as vulnerable within the context of the COVID pandemic, and as a result of that, have fallen between the cracks in terms of decision-making. So I think one of the challenges here is that either there is no collective definition of vulnerable for this work. I understand that there's one for the City of Toronto, and I'm not sure about the relationship to this work, but if there is one being developed in terms of the City of Toronto's recovery and rebuild plan, I think it's very important that people with disabilities are included there, because otherwise what we've seen in terms of other contexts and other jurisdictions is that people with disabilities fall through the cracks in terms of the decision making. We are not elevated in terms of our visibility as a community in a way that then has knock-on impact and is accounted for in terms of other decisions. So that's the first one for me. I think also there is still a lack of consideration for accessibility across the initiatives that we've seen rolled out. So I think that, you know, we want to be able to talk to Curb TO and Active TO and the various range of initiatives that have happened in terms of Toronto's response so far. None of those initiatives have been presented to this committee. So they have been rolled out, and I understand that this is, you know, in terms of a crisis, but they have largely been rolled out without consideration of the TAC. So there has been no opportunity for us to be able to provide any input, or in fact to offer the perspective of our communities in that context. I think that's a concern too. And then 2 more for me. Income supports are of critical concern to our community. And so we've seen that in certain contexts, the government of Ontario and the Canadian government have been able to come up with money, you know, $2,000 a month in terms of the CERB. But for people with disabilities who are living on ODSP, that money is being clawed back. And so we are seeing people with disabilities still struggling to be able to afford to eat, frankly. And food security is one of the main issues as well. I think this came up a little bit at the last meeting, but in terms of many of the folks that I work with who are people with physical disabilities who live at home or in supportive housing, food security has been an issue throughout this pandemic because people have been able to phone in some cases for delivery, but the delivery has been dropped off in their lobbies. And so they can't actually even get the food, if they're in the position to be able to order it, into their houses to be able to eat. So that has been a real concern. I also want to just speak to the lack of accessible housing. So we're still in a situation where people with disabilities are struggling to be able to find anywhere to live. And what we've seen in terms of the hospitals is that anybody with alternate level of care status has been asked to leave hospitals and try to move back into the community. And people with disabilities are really struggling to find places to live. Councillor, if I could add one more thing, there's still a lack of access to in-home testing for people with disabilities who are considered to be housebound. It's something that I have actually been working with the Toronto Central LHIN on, but if you are a person with a disability who faces accessibility issues trying to get out to testing centres because you have suspected COVID, you still have no opportunity at the moment to be able to have that testing come to you, and I think that's a real concern for our community too.
Wendy, thank you. Your timing is pretty good. You actually still have 30 seconds. But
okay, so maybe I can add one more issue that I know has been very significant for our community as well. People with disabilities, many people with physical disabilities rely on an attendant or somebody else to help them when they're in, just with things like using the bathroom, eating, activities of daily living. And in the hospitals in Toronto, there have been a range of responses to allowing people, support people, and to help people with disabilities when they have to go to hospital. So I personally know of a number of situations where people with disabilities have, even just recently, within the context of recovery, gone to hospital for treatment and have had to leave the hospitals because the hospitals themselves have said that they are not allowed to have attendants or family members come in with them to support them. And so these are folks who, if they are left completely on their own, actually are at great risk. And it has been astonishing to me that even though we're supposed to be seeing a relaxing of these kinds of regulations, we have actually been personally contacted by a number of people who have had to leave hospital against medical advice because they can't get that kind of assistance.
Okay. Thank you very much, Wendy. If the clerk can please put the screen back on. Are there any other members? Liv, I see your hand, thank you. And then following Liv, there is Michael McNeely. And Michael Michelli, I cannot see you, but do you want to speak as well? Yes, you do. Okay, thank you. And then Miranda Frey. Go ahead, Liv, to answer the first question.
I could echo a lot of what Wendy said in terms of seeking in-home testing, issues around family support and caregivers not being able to attend. With the population we primarily support, this is a big issue in group homes and congregate living settings as well, where people have had zero access to their family members, their loved ones, and their support staff for months, and the isolation and disruption is quite terrifying. So those are all issues. I think the issues of income supports, absolutely. And that also dovetails with issues around funding for what can be made available in terms of programming, whether it's online support programming, recreation, any kind of respite funding. We support a lot of young adults with disabilities, and they have really let us know that they have felt that they've lost their hard-won independence during this period. And we support a lot of family caregivers and other caregivers who are absolutely exhausted and doing the absolute best they can to support their loved one. But we have, parents in their 70s plus supporting young adults, and they simply don't have the capacity to do that, and really increasingly complex and difficult situations arising as a result. So, there hasn't been enough or really any funding specifically to support individuals who do live either independently or at home with family for programming, the things that once anchored their days, whether it be work, part-time work, volunteer work, those things have all disappeared. And there is a large group of people who have had their independence disappear, who are isolated, who are depressed, and who see no end in sight, because even as others may be returning to life in the physical world as opposed to the virtual world, they tend to have health reasons where that won't be possible for them. So they're not looking at the next months, they're looking at, until there's a vaccine. And so there is a lot of real hopelessness that is setting in as this becomes a longer term situation. And I absolutely agree about income support. So I know the federal government is finally looking to provide $600 one-time payment. I know it's not necessarily the city's domain, but the advocacy that could be done with the province, Ontario is one of few provinces that are clawing back so that people can't access CERB. And people, as Wendy identified, we're seeing the same thing. We're seeing people who were food insecure are really in dire straits. People who weren't food insecure are now food insecure. And people who are just reeling the longer this goes on and worried, they are in absolute hand-to-mouth situations. And not to mention the situation for homeless people in the city who do have disabilities. A large number of people within our homeless population are disabled and have not been able to access accessible supports. And are also very susceptible to COVID. So those are a lot of the concerns that we have. The other one that I mentioned at our previous meeting is just how we are collecting information. I really would like to see Toronto Public Health. It's great that they are now disaggregating data around race. I really think it is high time that we collected information around disability and the impact of this virus and pandemic on people with disabilities.
Great. Liv, thank you very much for your remarks. I want to also acknowledge Michael McNeely to speak. You may have to unmute your microphone. Michael McNeely? Michael, we cannot hear you. Yes, go ahead. We can hear you now.
Okay. So, I agree fundamentally with what Wendy and Liv have said. I think as a person with a disability, I do feel hopelessness and I do feel despair. And I do feel uncertainty about the future. I feel as if our voices are not valued despite the presence of this meeting. I feel like we need more of a say on issues that affect us in order to alleviate those feelings of hopelessness and despair. I feel that there needs to be employment opportunities with unlimited means of technology available for people with disabilities, so that people with disabilities can find some meaning in their experience and their trauma.
I'm bored already.
So,
yeah, it took me a grand total of 2 minutes to get ready.
Sorry,
By the
Michael,
way,
just to interrupt.
I want to tell you something.
Can I let you know that there is somebody,
You've upset me.
somebody has, okay. Do you know who that was? Did we get bombed? Okay. All right, sorry, folks. Michael, sorry for that interruption. I will start your time again. Please go ahead.
no problem. Means I get to talk longer, I guess. But ultimately, what I'm arguing for is that people with disabilities need more employment opportunities, and we need to think outside of the box to give them those employment opportunities. Not only are the employment opportunities important in and of themselves, but they're important for people with disabilities to feel that they belong and can contribute to the community at large. In all this discussion, I haven't seen any discussion about employment opportunities. And I believe that people with disabilities are the best ones to advocate for not only themselves, but also can reach out to other people with disabilities in order to provide information, networks, counseling, and other kinds of supports that are fundamentally needed. Another issue that I want to address is with regards to businesses. It's unclear if they have accessibility as a priority. It's unclear if they are trying to be accessible with regards to COVID-19 conditions, or whether or not they have used this opportunity to limit access to others not like themselves. So, for example, if I were to go to the convenience store, I'm not necessarily aware that they're still accessible as they were, as they had to be maybe a year ago or 2 years ago. I'm not sure if that same accessibility standard has been met now. Limitations with regard to traveling out in the community are important to consider because bathrooms are not readily available and public transportation is not readily available, nor are there safe means to travel. So I think those are the things that I would like to address, and I'm happy to hear what everyone else has to say. Thank you.
Sorry, thank you, Michael McNeely. I appreciate those remarks. Also on the speakers list is Michael Michelli, followed by Miranda Frey.
Okay, so I guess I can go next. Basically, I'm just going to echo everything that Wendy and Liv and Michael already talked about. I'm going to try to keep my remarks short. I think one of the most important things is just even getting basic access to personal protective equipment for people with disabilities has been a challenge. I know in terms of my own experiences, trying to get masks was very difficult. Even whenever I would call around to any place, the first question that I would get asked is, are you a healthcare professional or provider? And I would say no. And they would always say, well, you know, the priority is for those. Even with people with disabilities, trying to get access to gloves has been a huge issue. So I think that's one of the major priorities is just getting access to PPEs. Even I remember, I live in the north end of the city, and therefore I fall under the central LHIN rather than the Toronto LHIN. And I contacted my care coordinator, asking her, you know, are they providing any masks? And the first question she asked me was, do you have COVID-19? And I said, no. Oh, that's good, because only if you have it, then you get a mask. And again, that's something that you would think should be an easier access point to get things. I think one of the other things too, in terms of people with disabilities, I mean, we have this forum here, but yet I think of my friends, for example, who are living either in long-term care facilities or nursing homes or complex continuing care, and their experiences have been absolutely devastating in terms of the lack of staff, in terms of issues whereby they have been confined to their rooms or confined to bed, for example. There's been huge healthcare issues that have not been sort of readily addressed. I mean, Wendy and Liv talked about the anxiety and the depression, but you've also had new health issues such as pressure sores, where people who are lying in bed for longer periods of time, and you know, what are the healthcare costs of that? Also as well for older adults in terms of experiencing delirium or hallucinations from not having that social interaction with friends or family. And I think it really sort of shows that our healthcare system, and especially in terms of long-term care, is really a house of cards. And without friends and family to provide support, the healthcare status of people really deteriorates. I also have to echo the call for in-home COVID-19 testing. I think it would help reduce a huge barrier for people with disabilities in terms of having to go out to get the testing, testing at home. One of the other things that I want to mention was for the Office of the Recovery and Rebuild, I did one of the surveys, and of course, one of the first questions asked to input your postal code, the first 3 digits, did that, went on to the rest of the survey, all of the demographics are at the end. And then when it was time for me to submit my survey, it wouldn't accept it because for whatever reason, the software was so specific as to how you input the first 3 digits of your postal code that it wouldn't let me do it. So I had to go back, try it again, it wouldn't work, tried it a couple of times, and in the end, I just sort of threw it in my hands and said, okay, it's not going to let me submit it, I'll do it again. So there is definitely glitches in terms of submitting the survey. I was also going to echo the points about food insecurity. In the apartment building I live, management also had put out a notice to all residents saying, effective immediately, food deliveries, all other deliveries, you had to go downstairs to the lobby. They were no longer going to be allowing them to be brought up to the door. And of course, the whole issue is if you have everybody going downstairs to the lobby and congregating, you're more likely to spread the virus. The good thing in my building was there was no enforcement mechanism, but I'm not sure what the case is in other places. And so just once again, there really does need to be more outreach to all people with disabilities, regardless of what their location is. Thank you.
Okay. Michael, thank you for your comments. Miranda, do you want to proceed?
Yes, thank you. I just want to say that I really do support what has been said by the other members. I think it's very important. And I really do like this question because it covers the different aspects of every stakeholder involved in this. Being in the community with the employment services programs that I work within, you see a lot of the different perspectives of how this pandemic has impacted everyone in different ways. And in looking at it, how it all affects people with disabilities. So I kind of just jot down a few things that I want to share. In terms of looking at different businesses and sectors, and also, how access is very important to persons with disability. Within our program, we see a lot where computer and technology, even something as simple as having a mobile phone to look for work or to confirm for interviews, etc. That has been a challenge for persons with disability. And I do see that more support is needed there so that they're not falling through the gaps. For businesses, a lot of the businesses, especially small businesses, they are very much impacted right now if they do not have a very enhanced online presence where their customers, their clients can purchase things online. And especially when it comes to persons with disability, if they need essential things from specific vendors and they do not have that online access, then that is definitely a problem. They're going to have to do without. There's a lot of lack in terms of what they need for their daily living. What Michael mentioned about the PPEs, I thought that was very important as well. I also want to add also face shields. A lot of times as well, people are supported with the mask, but face shields for some reason is seen as something that is not an essential, not so necessary. And I think it is important to have the face shields as well, because if you are in a very closed space where there's no room to manipulate the space that you're in, then that's an issue. There's no barrier or anything to protect the person, but if a facial is available, then that is some kind of a protection as well. Also, in regards to, in addition to food security, I would mention clothing provision. During the pandemic, a lot of donation centers were closed down, locked down, and people did not have access anymore to get clothing for their essential needs. So that is another issue as well that needs to be addressed. Home care services, someone had mentioned, is very essential. For daily living, some people have not been able to get the home service in, especially if they are not on ODSP. There's persons with disabilities who have even self-disclosed, but because they're not on ODSP, sometimes it means as if they're not counted. And, I think that needs to be addressed as well. Something else I want to mention that I just remembered, for the emergency fund, it seems like those who have been working throughout this pandemic so far have not been eligible for the emergency fund with, whatever given parameters and guidelines that have been standardized and set in place. That given, some of these people have also been taking care of elderly, seniors, parents that are disabled. And during this pandemic, a lot of the cost of living essentials have gone up and wages have stayed the same. So that is giving a series of gaps between the well-being and economic health of those who are being taken care of by caregivers. So I want to mention that because there needs to be something that can help cushion the effects and the impact that the pandemic has had on these people. Although they're working, but cost of living has gone up, food, everything has gone up, but wages are the same. So they are trying to stretch in different ways to try and meet and still provide and take care of their elderly parents that are disabled. So that's another thing I think needs to be addressed. And that's all for me. Thank you.
Okay, thank you, Miranda. I must say each and every single one of you are doing extremely well just managing your own time. Miranda, you almost stopped directly at the 5-minute mark. Is there anyone who would like to answer this question, or should we proceed to the second and third portions of the recovery questions? Okay, seeing none. And seeing none, okay. So I'm going to read the questions heading into the bottom half of recovery. And what I'm going to suggest is that we actually group these two questions together, because I do believe that they line up very nicely by one, you identifying what are the 2 to 3 most important needs for recovery in your business sector or community, and how should these needs be prioritized. So this question, of course, just speaks to, given all the things that need to be done, what needs to be done first? What's the most urgent thing, if we can? So again, I'm going to read the question. What are the 2 to 3 most important needs for recovery for your business sector or community, and how should these needs be prioritized? And I see Michael McNeely's hand go up first. If I can just see the screen as well. No other hands. Why don't we just start with Michael McNeely? Okay, Michael, if you want to unmute your microphone, and I'll give you 5 minutes on the clock. Thank you.
Can you hear me?
Yes, perfect.
So I noticed one of those 3 things that we can do to start, and the others will have more to say, but something that I really think is urgent, and something that we've already spoken about, is that we need information in an accessible location that relates to people with disabilities, so that we can understand what is happening to our entire community, and that we can be informed about what is going on. Furthermore, this central location could be a way for us to help others access that information. So, for example, if we have a friend, or we have a loved one, and we know they're isolated, and we know they don't have technology, we can find a way for them to get this information that's already in a central location. Thank you.
Thank you, Michael. Have you concluded your remarks? Michael, are you finished?
Yes, I have.
Okay, thank you. Are there any other members who would like to answer this question? Liv, and then followed by Wendy. Go ahead, Liv.
I think of the things we identify, they're all very important. I think getting data collected and disaggregated is going to be vital to inform all the decision making that we're talking about and prioritizing that we're talking about. So I think that's key. I agree with Michael that information has not reached everybody, has not been disseminated, and has not been accessible. The information put out has not been in plain language. Recently, public health has been better about creating pictorials, but in general, I know our agency has been doing lots and lots and lots of explaining, interpreting public health and city information, and I would encourage the city to go back to making sure that things are available in accessible formats and in plain language as per the AODA. Where I sit, I think the most important thing to look at, and given the city, is going to be facing a huge budget shortfall and there could be service cuts, is the specific vulnerability of this population and the funding that is going to be needed to support, whether it's through recreation, whether it's through food security issues. Like, there are a number of ways to support this population, but if they're not identified, if we aren't identified as in need of specific supports, people will fall through the cracks, and disability communities have been amongst the hardest hit in a number of ways, but including in terms of illness and death from COVID, and that needs to be recognized. I'll stop there.
Great. Thank you. Followed by Wendy.
Thank you. I wanted to come back to how we characterize and consider vulnerable populations within the context of the plans that are being rolled out by the tour. I think that it's a priority to determine if there are populations that are considered within this context, how do you define them, and making sure that people with disabilities are included in that population. I think a number of many decisions will be made on the basis of the plans that come out of these consultations and out of the tour offices. And I think that we need to have a mechanism that is formally established that recognizes people with disabilities and the unique vulnerabilities that our community faces in the context of COVID, when it's in crisis, when we're in recovery mode, when we're in rebuild mode, so that our population doesn't fall through the cracks again. I think many of us who work quite closely with the Ministry of Health we're seeing this as a quiet period, but we're all planning for wave 2. And so what we didn't do right the last time, hopefully we can repair in terms of making sure that people with disabilities have some kind of formal status within the context of this planning process that acknowledges all of these particular vulnerabilities that are certainly not acknowledged to date, that are quite invisible. I want to just support what Liv was saying around the data collection on disability. I think, it is great also that, there is this, that we are now looking at race in the context of the data that's collected. I think disability has to be there as well. We will be going back one day and looking back at how did we do. We will not, as a community of people with disabilities, be able to see ourselves in the story again because we have no markers. So many people with disabilities are impacted, as we've heard, by COVID in a multitude of ways. If we cannot disaggregate people with disabilities from the data that's collected, our story is again invisible. And so I really support what Liv is saying around making sure that we're collecting data on disability. I wanted to say the third priority, I think, for me is working with public health and making sure that people with disabilities are on their radar in terms of their needs for things like testing at home, for access to PPE. We've heard a couple of stories here about people having difficulty accessing basic PPE. Much of what the response has been, in terms of certainly the crisis period of this, has been through public health actions. And to date, again, people with disabilities are not entirely on the radar in terms of our very unique vulnerabilities to COVID. So I would say that those are areas that need to be addressed as priorities.
Great. Wendy, thank you. Are there any other members who would like to answer questions 2 and 3? Michael Misali, go ahead, please. You'll have to unmute your microphone.
Okay, thank you. There we go. I got it. I'm just going to keep my remarks pretty short, though. I think the most important thing, or immediate need, and just echoing what everyone else has said, has really been that about information. Getting access to information that's timely and relevant has been difficult. So, for example, when I had to start looking for masks, it was only me sort of searching on my own or asking for friends. I couldn't really find a reliable source. Same thing as well in terms of food access. Just as I mentioned before, last meeting, it was only because I heard Mayor Tory's press conference and the city partnered up with the Canadian Red Cross, and most people didn't know about it. I have just sort of found that information has been scattered and sort of split in a whole bunch of different areas and not has been sort of connected all in one central location. So you might have Toronto Public Health having one area website of information, the province another area, the federal government a third area. I would have think for most people with disabilities, if information was centrally located that included everything, I think that would have been helpful. As I mentioned at the last meeting, I remember when I looked at the Toronto Public Health website just to try to find information, it was very difficult. It was not presented in an easy, helpful format in terms of looking. So I think when we make this information available, it has to be very easy to find and user-friendly. I think the last thing that I will also say too, though, is when I think about people with disabilities, we need to look at things in a holistic fashion, though, and not sort of be sort of separate, discrete categories. So when I was talking about health issues earlier, and for example, the increase of individuals having pressure sores because they're now confined to bed for a much longer period of time, and they're also having issues of food insecurity. Well, the lack of nutrition is going to hamper that ability to heal those wounds, but yet those are sort of always viewed as separate. Thank you.
Great, and thank you very much, Michael. Anyone else to answer second half, third half of the recovery questions? Miranda, I see and acknowledge you. You want to unmute your microphone, and I'll start your clock.
Yes, thank you. So I would like to also add, for this question, my answer would be, when you look at business needs, something that is very helpful and support for that would be needs assessment. To be a general client service assessment as well as specific individual customized needs assessment. And when I think in particular of needs in regards to barriers that persons with disabilities face, I think like in-home assessments that are conducted by occupational therapists is very essential because that dives deep into the specific needs of the individual and the challenges that they face. And so I just want to add that as well. Thank you.
Great. Miranda, thank you. So if I can get the screen again so I can see everyone's cute faces. That's okay. Are there any members who would like to speak to question number 2 or 3? Okay, seeing none. Before we proceed to the next batch of questions, what I'd like to do is also just provide a few thoughts on this one, if I may. And I'll start my own clock. Okay. I think it's, I mean, everything that everyone has already said, I would like to definitely echo, but I won't repeat it because it's, they've all said it so eloquently. I observe that the city is struggling, of course, to respond to a global pandemic. What I think is absolutely important, but I detect missing from many of the responses, is a evaluation format around equity. And so therefore, the equity accessibility lens, how you measure a response on who is going to get access to that new and or enhanced or modified service seems to be missing for people living with disabilities. And I raise this issue because I have been doing it quietly behind the scenes with city staff on the different responses the city has come out with, and I always seem to be asking a question that they had not considered. So Saad and Mark and Ryan, recognizing how important this phase of work that you've been tasked to deliver, if you can ensure that there is an accessibility lens, an equity lens over how you measure your recommendations before you place them before the city manager, and make sure that that lens is publicly available and you provide a clear evaluation and methodology on how you've come out with your recommendations, I think that would be helpful. It just sort of captures what everyone has said, but it actually sort of anchors it down in a way that we can all recognize that you have and the team has properly considered this particular vulnerable population. I won't go into any further than that because I know you've got a lot already. What I'd like to do is just proceed now to the second phase of the questions. And the second portion is largely premised on the rebuild piece. So the clerks will put the screen back up, and I'm just going to read the questions out loud. What I'd like to do is, because I gather that these three questions can sort of be, it can literally be merged together. What I'm going to ask the members to do is to organize your thoughts and your comments so you can speak to these three questions. I'm going to just read them out loud. What does the future state of your business sector community look like for you right now? So what does the future state of your business sector community look like for you right now? Are there changes that have occurred in your business sector community that you think will be part of the new normal? Are there changes that have occurred in your business sector community that you think will be part of the new normal? And then the third leg of this group of questions is, what are the long-term opportunities can be explored? What are the long-term opportunities which can be explored for rebuilding this city in a better form for your business sector or community? Sorry if I'm taking some editing liberties here. So literally, what are the long-term opportunities that can be explored for rebuilding the city in a better form for your business sector community? Okay, so we'll take that screen back down and I can see all your faces, mostly. If you want to indicate who would like to speak first, Liv, I see you. And I'll start your clock. Everybody else is gathering their thoughts. I'm going to encourage those who haven't spoken, if you have something to say and contribute, we're getting to that time. Liv, please go ahead.
A general point that I think is a lot of factors is around as rebuild and reopening begins, there need to be guidelines on how the changes that are taking place in our physical space will be made accessible. So that's a big piece of the rebuild that I don't think enough consideration has been given to. Every business is doing its own thing with plexiglass or with markers on the floor or with standard guidelines on how to make sure that these improvements to allow for distancing, et cetera, to make sure that those are accessible. And I know later we're going to talk about Cafe Bio and some of these other pieces that have changed the built environment. But I think there need to be guidelines specifically around accessibility there. With regards to the sector specifically, I think, some of what we outlined in terms of difficulties, I think the opportunities are around partnerships between different organizations, different agencies, different programs that may not have partnered before. I think there's a lot of opportunity for innovation. I think we are going to be in the online world a lot longer maybe than some other sectors. But specifically, I work out of a community center, which is struggling, as are many not-for-profits. Revenue streams are gone, and yet we still need to provide the same services, if not increased and more supportive services, to people who are in increased distress. So how the not-for-profit sector, and specifically not-for-profits supporting people with disabilities, and how disabled folks continue to be supported in finding employment, maintaining employment, getting the recreation and social supports that they need, getting the therapies that they need. All of these things are up in the air. And so there's no revenue streams or limited revenue streams. A lot of fears around cuts to funding agencies that are going to be coming, and yet the need for supported programming is exponentially greater, and the cost of doing anything in person, with the need for smaller ratios, greater cleaning, all of those things that are essential, there's a real question about survival of a lot of not-for-profits that support disabled folks and deaf folks. And I think that really needs, again, if there's any specific look at who is vulnerable as specific populations, this population is definitely vulnerable, both as individuals in terms of the virus, but also as a group in terms of the support stressors being in real question of survival.
Great. Thank you very much, Liv. And if I can get the screen with faces again. Anyone else who would like to speak to this three group of questions? Michael Michelli and Wendy. Michael, if you want to unmute your microphone.
There we go. Thank you. Just in terms, I'll be brief. I think the sense that a lot of people have is there's just this tremendous sense of uncertainty for everyone and for people with disabilities in particular. But I think one of the things that I have sort of noticed is that for the last 20, 30, 40 years, people with disabilities have made great strides and increased visibility in society, where you're more likely to see a person with a disability pre-COVID than you did before. And I think one of the concerns, if we're operating in this quote-unquote new normal, is that those are very hard fought, battles or gains are going to be lost, and that visibility is going to be lost. And that whenever you would see a person with a disability, it would sort of make issues, whether it's a lack of accessibility, lack of support, visible. And suddenly when you don't see people with disabilities as often, suddenly you don't think about things. Where in my case, for the last 4 months, I've been at home, and when I've seen neighbors, suddenly it's like, oh, we forgot about you, Michael, because we didn't see you anymore. So the other thing too that I was also going to say is there is concern that as we move forward with this quote-unquote new normal, a lot of the barriers that are now coming up, there's going to be sort of an increase, whether that is plexiglass, for example, in grocery stores, where if somebody needs assistance from a cashier, they're not going to be able to do it because they can't get through that plexiglass. Or there is that sort of sense of, for example, I have friends where they can't open up their own wallet, and they would have a cashier take the money out of their wallet. Now all of a sudden they're being refused service. So I think what we're starting to see is that there's going to be an increase in barriers that's going to limit the the participation and visibility of people with disabilities even more, and especially when they're not able to gain support services, similar to what Wendy brought up in hospitals, whereby if individuals are going into a hospital, they're not allowed to bring a support person with them, and suddenly they're struggling on their own. We're going to see more and more of that. Also, similar to what Liv was saying, I am concerned that we're going to be entering into an age of austerity, whereby there are going to be significant funding cuts, and a lot of agencies that do provide supports and services to people with disabilities may simply not survive, and especially in a time when those supports and services are needed more than ever. Thank you.
Great. Michael, thank you for your comments. And then heading over to Wendy, and then followed by Michael McNeely. Go ahead, Wendy.
Thank you. I want to be brief too, because I think there's been a lot of amazing things said here today already. But, you know, in terms of the current, what our community looks like, our sector looks like right now, many people, and people have said this already today, but just to echo it again, you know, the thing that people with disabilities have lost through the pandemic is their hard-won independence. So we are seeing lots of folks who are still largely very vulnerable. Most folks that I work with will not be rejoining society in any meaningful way, you know, out and about in the world until there is a vaccine, as has been said already today. And also, you know, I think we're not in the world, but we're also not in any of these formal planning structures, as I've said, and I've said it a number of times already. But there is no equity lens being applied yet. There is no guidance around how to rebuild and recover that includes accessibility, how to do it so that somebody who can't see the tape on the floor again, for example, knows how to socially distance. There has been no targeted funding that has been provided to this community. We're still waiting on money, you know, again, outside of your jurisdiction, but the $600 from the federal government that has been discussed previously still has not been released. There's no particular guidance documents in terms of the healthcare context that addresses the needs of this particular population. So, you know, perhaps this is the new normal that is really hard to take, is that we thought we had made some progress, and it feels like we've lost a lot of that progress. One of the things where we might have an opportunity is that many of the things that are happening now are happening online. So our meetings are happening online, and many consultations are happening online. That provides an opportunity for people with disabilities to be able to be employed, you know, remotely, to be able to take part in these kinds of consultations. But it means that the technology that's used is critically important, and it has to be accessible. And I know that there have been some folks, in fact, who may have had some issues even with WebEx, the tool that the city's using now. So, you know, if we think about that and we do it properly, it provides an opportunity. But if we don't, we are cutting people out who are already disenfranchised. Yeah, that's all I really want to say. I think that there's an opportunity here just in terms of the remote piece, but we really have to do it carefully and thoughtfully. And in terms of the other pieces, you know, the new normal right now, as far as I can see it, is that we've taken another step back. And if we can at least adjust and have some presence in terms of these planning functions going forward, perhaps we can regain a lot of the independence that people have frankly lost through the pandemic.
Wendy, thank you for your comments. Michael McNeely, and then going back to Liv. You're on mute, Michael.
So I'm just waiting for the caption to catch up. You can hear me?
Yes, we can.
Okay. So I need to get something off my chest. I think on Saturday in Nathan Phillips Square there was a protest against wearing masks, and one of the posters said, "Haha, all the people come and be prepared to die." And I'm struggling with how to respond to that, because it was a protest against wearing masks. And I'm sure that statement was made in earnest, it was made as in a joking manner. But the reality is, we are living with people that do not take our health as a priority. We are living with people that are out there and engaging in the world in different ways that we cannot. For fear of our own safety and for fear of other people's safety. So I think we need to be careful when using words like rebuild and recovery, because we are not rebuilding and we are not recovering necessarily as fast as other people are. And if we say, for example, that my friend has recovered, but I haven't, where does that leave me? Where does that leave other people who, like Wendy has mentioned, are unable to go outside or unable to engage in family or leisure activities? It's important to realize that we will have, if we are still alive at the end of COVID, we will have endured a lot of trauma. And we will be unable to actually adequately describe the trauma that we've experienced. But a lot of that trauma will be the loss of our friends, our brothers and our sisters in the disability movement and in the disability community. What do we do with those people that are lost? What do we do with those people that are not with us anymore? How are we supposed to recover if those people are not alive? How are we supposed to recover if those in society didn't understand what we had to go through to get to this point? If we don't have a voice at the table, then that's probably because we were not appreciated or valued as a member of society. If, as my friend Michael has said, if we can be forgotten about because we're not outside, then what difference do we make in the long run? I know it's pretty depressing to say these things, but that ultimately we need to remember that there's a great deal of social inequality here. And we need to address that now and after COVID is over. We need to address how we were treated. And we should not be taking silence as an answer. That's all I have to say. Thank you.
Michael, thank you for those pointed remarks. Maybe we just take a moment to breathe and hold space for that. Yeah, this is a very tough conversation, and I hope that Saad and that the team. I would imagine that you recognize that for the members to share what they are sharing, it's some of it is incredibly personal, but it's all coming through lived experience, through conversations with community members, with other friends. They're bringing to you the voices that cannot join this meeting today. So I want to say thank you for number one, listening, but also to become our champion as you build out the rest of the report. Coming back to Liv. Go ahead.
I think, Michael, I really want to honor what you've said, and I was thinking along the same lines, but in a slightly different direction. But I do want to state, just so the committee knows how hard hit this has been. I mean, we have lost quite a few community members. This has hit us very hard and very personally. And of all ages and in congregate care homes and people living independently. It really has hit a wide swath of people and has been personally quite devastating to community members, to all of us. The thing I wanted to point out was, as our organizations, our agencies will be struggling with cuts and with lack of revenue and all of those things, we also will have a lot more people to care for, because it does appear that people recovering from COVID are not recovering. They're having long-term impact And we are the organizations that are going to be there to support people who have ongoing neurological issues, who have ongoing health issues. And so I just want to point that out, that as the rest of the world recovers, not only are people who already have disabilities, born with or acquired, potentially going to be left out, but so are those who are not recovering well from COVID, who have long-term impact to all sorts of their circulatory and systems and organs. And what we're learning about COVID from places that were hit first, like South Korea and Italy, we're learning that people have lots of ongoing effects, and those people will need support. So I hope that there's thinking around that as we look at the planning.
Thank you, Liv. Are there any other members who would like to speak to this one? Okay, Howard, and then Howard, Michael Michelli, and then back to Wendy. Okay, Howard,
Thank
go
you.
ahead.
Mike, I agree 100% with what you said. I think one of the problems we are facing right now is that we are using a shotgun approach to all the problems that are out there. I think we should be listing all the items, that we have concerns with, and then start to prioritize them as to which ones we should be attacking first. I know from my own community group that transportation has been one of the key factors in not giving them opportunities to continue working and living. And I know that ACAT has not been functioning now for the past, 5 months. Wheel-Trans has been operating on their own in terms of not planning for the future and the present. So, there are definite lack of planning that went on, and there's lack of planning on what's going to happen now. Wheel-Trans should have been there to support us. It's not. That's all I have to say at this moment. Thank you.
Howard, thank you for those remarks. Michael Michelli.
Okay, hi there. Just going to say one thing off of what Liv was saying. Over the weekend, there was an expose by Global News, and there was a term that I learned called COVID long haulers. And what they're finding is that individuals who were first diagnosed with COVID-19 back in, say, March and April, they've been tested negative, tested positive after their quarantine period, tested negative. But what they were finding was that they were experiencing long-term symptoms, primarily extreme fatigue and lethargy, brain fog, difficulty concentrating. And yet what the individuals were finding was that they would go to their doctors and their symptoms would be dismissed. So there's a lot there whereby even individuals who are quote unquote, negative for the virus are still finding that they're experiencing negative symptoms. So that is going to be an issue that we're going to come up, that people are not really going to fully recover. But I think we need to use that language of COVID long haulers to fully understand the issue. Thank you.
Okay, Michael, thank you. Coming back to Wendy.
Thank you. I just wanted to mention something about a broader contextual piece here too, just in light of some of the comments that you're hearing from folks. And it certainly is a hard conversation, I think, for all of us to have. There is a triage protocol that has been put together by the Ontario Ministry of Health that literally says in the event of there being a COVID surge, that having a disability, and there are a number of criteria attached to this, having seen the early drafts of this document, but having a disability is a reason for you potentially to be deprioritized in the instance of a surge and numbers for treatment. So having a disability could mean, if we have a surge again, that you would not be treated for COVID by virtue of just you having a disability, frankly. And I'm mentioning this just because what we're doing here today and what we're talking about and what we're saying and what we're encouraging you to do in terms of the work that the TOR has to undertake is important. It's really important because being able to support people with disabilities to be safe at home and in the community and to have decisions made with them in mind is all we have. In some cases, if people are going to get to the hospital, if we have a wave 2 and we have a surge, and there are different levels of surge in the triage protocol, and certainly you can find the original draft triage protocol online if you're interested in reading it. But if we do enter back into those kinds of circumstances, there is literally a chance that somebody with a disability would not be given care in the context of a crisis related to COVID. And I can say that in places in the States where this has happened, with these similar kinds of protocols, people with disabilities have been encouraged to, for example, write letters that shows them as a person in their life, bring pictures of their dog, bring pictures of their family to the hospital, have something to give to a doctor in the event that somebody's going to be in a position to decide whether or not your quality of life and what your life looks like as a disabled person is good enough for you to be able to merit treatment. So, this is a hard conversation that we're having, and this is the real context that we're living in. And they're working on a second draft of triage protocol now. I haven't seen the second draft, but as I understand it, it's still very similar. It still uses some of these criteria as ways of making decisions about who deserves to have treatment in the event that they're sick and who doesn't. And our community is still not considered to be the same as everybody else. And so that's not right. And in that context, we are all asking you to please do your best to include us, to address our concerns, to make sure that there is that equity lens that Councillor Wong-Tam was talking about in terms of this work, because we need help. We need your support. We need to know that we're not going to get there, because if we get there, the consequences are quite dire. Thank you.
Wendy, thank you for your comments there. And I'm just waiting for my screen to pop back up so I can see everybody. Great, thank you. Is there anyone who's interested in speaking to this last group of questions under the category of rebuild who has not spoken? Michelle and then Miranda. Afterwards, if Michelle and Miranda are our last speakers, what I'd like to do is then proceed to the extra group of questions that I put forward. Is that okay? So we'll start with Michelle and then we'll head to Miranda. Go ahead, Michelle.
Thank you, Chair. I just wanted to thank all my fellow members, because a lot of what I wanted to talk about today has been addressed so eloquently, and I really appreciate having a lot of the concerns that have been bothering myself and my sector lately echoed with allies, so thank you. In terms of this group of questions and the idea of a new normal, I just want to speak a little bit more to the developmental services sector, which is what I touched on in our last meeting. And it's interesting to think about new normal. As so many people said today, the total loss of independence has been really crushing. And you've seen a real pivot to just having to take care of basic needs for folks, something that they've been struggling with to take care of themselves, and something we've been struggling with as an organization to be a support in a meaningful way. And I think one of the major things that the pandemic has brought to life in terms of vulnerabilities of our community is we still have congregate living situations, and day supports themselves are also very much a congregate gathering type of situation. So something like a pandemic exposes the fact that people are literally grouped together beyond capacity, because this is what we can afford as an organization, and are therefore made much more vulnerable when something hits like COVID-19. So these are basic things we're asking for, but when you have more affordable housing options, then people don't have to live with 10 other folks. They have the actual choice for independent living. It's not often their choice to live in a group home setting. So I always come back to affordable housing, but it's huge, and it's made ever more important by what we've seen lately. This should, as everyone else has been saying, be supplemented with access to PPE, access to food security, access to technology. These are all basic things that people should have to live. And we're seeing that it's not the case for many people that we're supporting. our sector itself, it's not only the people that we support that are undervalued, but often it's the frontline workers that are quite overworked and undervalued. So we've had pandemic pay enhancements that have taken effect during COVID-19 conditions, but I've heard no word about whether those will continue, and I can't even imagine trying to claw back people's paychecks, people that were so undervalued prior to this and are just making not even yet what they deserve, but at least a better hourly wage as frontline workers. So that continuing would be crucial as well. Day programs are another example of congregate gatherings. We are looking to reopen those with fewer participants, which was always kind of the goal, but you need funding for that to happen. So support there, pardon me. And just this not relying on caregivers that have been stretched to their absolute limits to do this work. It's not okay. It happens. We see it, especially with women and women of color outside of disability communities. But this is definitely happening in our sector as well. And there needs to be support. Not only should people have to take care of themselves and rely on their family and close friends, but there needs to be more done by the city and every other level of government. So that was just my input for today.
Okay. Michelle, thank you. Hearing from Miranda next.
Thank you. When I think about building, I think about social policy, and I hear a little bit of that from some of the other members that spoke prior to me. And so I think social policy going forward does need to consider, when they're thinking of social distancing and everything like that, to also consider and include things with disabilities when they roll out policies. Just an example of this, during the pandemic, especially in the first part of the pandemic, I went to a couple of grocery stores, and I noticed that when the stores started to limit the amount of people that are able to enter into the store at one time, that they had a policy where seniors in general, they didn't have to wait in line. They can just proceed and go in. But they didn't have a policy for persons with disabilities. So, I saw people in wheelchairs waiting in a long, lengthy line, and, it was just disheartening to see that these businesses were not considering persons with disability. So I just want to mention that too.
And Miranda, thank you. I'm just going to ask one last time. Are there any others who would like to speak to this last group of questions? Okay. Seeing none, we're going to, Saad, if you can obviously stay with us for a little bit longer. I want to just be able to place the three questions I have before the committee. And I'm just going to read all three questions, and maybe the members can group them together. I want to just cite that question number 2 speaks to some of the existing City of Toronto strategies, whether it's Curb TO, Cafe TO, Active TO. I just want to note, committee members, is that we are also going to be receiving a staff presentation on this at our September 24th meeting of TAC. But because Saad's report, I believe, is going to be tabled before then, I just want to make sure that you have a chance to speak to these current city responses to him, and as he evaluates and puts forward his report, because otherwise we're not going to be captured in that specifically to what the city is going to, what the city staff are going to be doing by the time they present to us in September 24th. So just so you understand, that's why that I'm bringing forward the sequence. Okay, so getting to the questions again. So this is the separate group of questions. The first, and you can answer them in any group in order that you want, but what I'd like to do is read all three questions and then acknowledge the members who'd like to speak to them. How can the City of Toronto better support your sector community through the recovery and rebuild process? So it may actually touch upon already what has been discussed. So if you feel like you've already answered that question, then leave it alone. But again, how can the the City of Toronto better support your sector community through the recovery and rebuild process? The second question is, which current strategies for recovery, and recognize that they've all been rolled out, whether it's curb TO, cafe TO, active TO, have negatively impacted your business sector or community? So which of those current strategies for recovery have negatively impacted your sector and community, and which ones have positively impacted the sector and community? And then finally, this is something that has been raised earlier, how would you like to be included through ongoing consultations? And I know that we kind of got to it our last meeting, but hopefully we can drill down and be maybe a little bit more specific. Okay, so ready, folks? This is our last group of questions, and then we'll give Saad and Mark a chance to speak to everything that they've heard today. Okay, so who would like to proceed? You're all exhausted now. Yeah, Wendy, you're a team player. Wendy, go ahead, please.
Thank you. I just wanted to say that it's hard to speak to some of these initiatives, Councillor Longton, without having a better sense of how they have actually been implemented. I wonder if I know that there is a timing issue here. Certainly, we spent a lot of time on this committee speaking to issues related to sidewalk and clear ways for people to be able to get down the sidewalk in previous years and previous sessions. And, a number of these initiatives would have an impact on that. It's hard to know what the impact is without understanding how the changes have been made. I can say generally, there are concerns for people with physical disabilities that I work with around anything that changes how much space is available for them to be able to go down a sidewalk. And, the implementation of cafe TO and curb TO are two things that could potentially either improve that if it's done in a way that is accessible, or, add additional significant barriers for people with disabilities. So it's hard to speak to some of these questions without being able to know, from the staff how they've been implemented. Can I say something else, though? I think, in terms of the ongoing consultation, how can we be included? And you've heard it multiple times already, so I'll keep it short, but, having some way of identifying people with disabilities within the plans and within the ongoing consultations and within the decision-making structures as being vulnerable because of this confluence of vulnerabilities, I think, is a critically important piece of us moving forward in a way that continues to acknowledge and include people with disabilities and doesn't set us up for additional accessibility barriers. When things change, they either change in a way that supports our community with being independent and being visible, or it locks us out of the community. And so if there's not an ongoing mechanism for us to be able to speak about those changes and to be considered in those changes and in that plan, then we are always at risk of losing whatever kinds of presence and visibility we've gained. Thank you.
Okay, thank you. Would it be helpful if I just quickly describe what those programs are? Curb TO, Active TO, and Cafe TO? Is that helpful? Okay, so then I won't make any, sorry, Michael, did you have a question? Michael McNeely, do you want to just unmute yourself if you have a question?
I just wanted to answer you.
Okay, go ahead. Are you just confirming that I should explain those programs?
No, I want to ask that you don't.
Okay. Sure.
Because I don't know how much longer I can last.
Okay.
I think if we had a document that we could look at, we could type out responses to that, if we're allowed to.
Okay, not a problem, Michael. I recognize that you may have to jump off. Liv, do you have a question to what I was just proposing, or do you also have a hard stop time?
I don't have a hard stop time. I have specific comments about those programs and what we're hearing from the community about them. But wait, if you want to describe them first, or
yes, thank you. I believe I could probably summarize those programs in about 2 minutes. And the reason why I think it's critically important is because they will continue to exist in the public realm. And I know that for people with who require mobility assistance, they've become a bit of an obstacle course. So just getting to the issue of all these programs. Active TO is the easiest one. I'll just start there. It's basically repurposing roadways and streets for physical activity. It's primarily on sort of heavy trafficked areas, not necessarily through a residential neighborhood. It's along the lakeshore and of course along Bayview. So basically we're not building a new community center, we're repurposing roads and temporarily moving vehicles off those roads to allow for physical activity. So that's what Active TO is. Cafe TO is the new cafe program that you are now experiencing, or perhaps you're seeing it. And Cafe TO actually is a new way of expanding the curbside lane where you normally have parked vehicles, and we now have taken them over for sort of patio extensions for the adjacent and operating business. And sometimes you don't need to purchase anything, but so they are either public parklets, that's what they're called, or public patios. And public patios would be managed and operated by the business owner, usually a licensed bar or restaurant. Public parklet is anybody can sit and just take a breather. The curb TO is where you see businesses or services that usually have a heavy queue of people waiting to get indoors. And curb TO is the takeover of the curb lane next to the sidewalk, and this is again where you see the big orange pylons, and they allow people to queue up, so therefore the sidewalk technically remains clear for people that are trying to travel past. And sometimes I've seen it also reverse, where the curbside lane, which is the curb TO program, demarcated and separated by the orange pylons, sometimes that becomes the pedestrian passage area, and then the queuing takes place on the sidewalk. It seems to be a little bit different according to how people are using it. So those are the three significant programs that have touched the public realm recently, and again, just citing the timing of our next TAC meeting and the timing of SOD's report. I just want to make sure you have a chance to speak to it. Okay, so Liv, before I come back to you, because Michael McNeely has a hard stop, maybe I would like to acknowledge Michael first, and thank you for your patience, everybody. Michael, if you can unmute yourself, please go ahead.
I just want to say, I think I'll excuse myself now, and I'm happy to hear about those programs. I was just afraid there was going to be another 60-minute PowerPoint presentation. I just have a exam tomorrow, so hopefully the next time I see you, I will pass that. I will have passed it. Okay, thank you very much for having me today.
Okay, thank you very much, Michael. And thanks for joining us. So I'm now going back into committee, first Liv Mendelson and then Wendy Porch. Liv, go ahead.
So what I can give are anecdotal comments more than anything. I'll make one general overall comment, which is the lack of accessible walkways in terms of planning for any of these outside initiatives is a huge barrier, a huge problem, and something that we're hearing about quite a bit. In terms of Cafe TO, it's a lovely program, but with the cafes blocking, or with the cafes using sidewalk space, there's been issues around wheelchair users and folks with blind trying to navigate that. But also with the cafes have come a lot of those A-frame signs that we've talked about in this committee before. So we're seeing a huge number of signs, informal signs of different sizes and placements done by different business owners, seemingly without a specific set of guidelines of how those should be deployed to preserve accessibility. So we've had anecdotes of people who are blind tripping knocking into signs, becoming injured, not good. In terms of curb TO, also an important initiative, but again, there seems to be a lack of understanding of the ways that it's supposed to be deployed, so that people are who are vulnerable are finding themselves not being able to use the sidewalk and having to use the street and navigate where cars are. Pylons or no pylons, that's been, and in some cases pylons haven't been deployed. It's just been a mess. So that has been dangerous. The other thing I want to raise are the new programs, which we are getting a lot of calls about around the parks, Parks for Kids, whatever that's called, Parks TO and Summer in the Six. We're getting a lot of calls from families not knowing if will there be accessible programming in these programs? Will people of all abilities be able to access them? And will there be opportunities for people to use accessible public washrooms? Has that been factored in? So, and those are questions I don't really yet have full answers to when families are calling us. So those are of concern. And one final concern, with all of the attempts to use public space to allow for recreation, which I think we are all in support of, has been the heat and the lack of opportunities for cooling, for people to cool down, especially if people do want to get exercise and get outside. There has been issues around overheating, lack of access to water to wash, to cool, and lack of access to cooling. So those are my kind of anecdotal reports.
Okay. Liv, thank you very much. You've done that really well, and all under just 2.5 minutes. Wendy, please go ahead.
Just a quick comment. So just Councillor Wong-Tam, and the way that you were describing the programs too, and I personally haven't been out of my house very often, so I haven't encountered many of these things. But the lack of consistency, in fact, in just your own description around whether there are pylons around the sidewalk or on the road, when we see things that are not consistent, it's an invitation for barriers, the kinds of which that Liv are talking about. So people with disabilities largely rely on there being some consistency around how these kinds of things are rolled out in terms of the physical presence of obstacles on a sidewalk. Certainly that would be very problematic for somebody with a visual disability who doesn't know, who can't see the pylons and know, in this case, they're on the sidewalk, in this other case, they're on the road. So, again, coming back to just if there had been some opportunity for this committee to have had some input in terms of the implementation, we would have stressed, certainly, that consistency across implementation is a really important consideration for our community in particular. Because when things are inconsistent and changeable, people will run into physical barriers that are quite dangerous sometimes.
Okay. Thank you, Wendy. Are there any other members who would like to speak? Okay. I don't see any more. We are oh, sorry, Miranda, I apologize. Miranda, go ahead, please.
Thank you. Just in general, I fully support these new programs. I think it's great. I think, it's a good start. We have to start somewhere, and I think it's a good starting point. The only thing I would state for these programs in general is just that the markup signs, the directional signs for these programs need to be very visual, and I mean not just markings on sidewalks, but also at a higher level, because sometimes a lot of people, they don't necessarily look down to see directional signs, but they look eye level. So sometimes I think even from places that I've been so far, that element is kind of missing or a little bit vague. But I think, it's very important to have that eye-level visual signs for social distancing practices. Thank you.
Thank you again, Miranda. And coming back to the big screen where I can see everybody, Michelle to speak, go ahead.
Thank you. Everyone pretty much covered what I was going to say, but I did want to just add, and again, it's anecdotal. I feel like it would have been really helpful to have TAC speak to these initiatives. I agree they're great, but I've been out and I've personally called in situations where a wheelchair user could absolutely not get through. That's been within several city blocks. You can see it on numerous occasions. I've also been with someone who fell because they were visually impaired, and someone using a scooter were trying to navigate a new patio situation, and it resulted in a hospital visit. It's a whole thing, but I feel like now the onus is on people with disabilities to call in these issues, and it just becomes, our responsibility again, versus if this had come to TAC, it really could have had a broader input from folks and could have maybe resulted in these injuries not happening and in people with using wheelchairs being actually able to access the streets they live on.
Okay. Michelle, thank you for your comments.
You're welcome. Thanks.
Okay, so we're just heading into the final bits. Anyone else to speak? Seeing, and if there are none, then I'm going to invite Saad and Mark, and I recognize that Glenn is probably not on the call anymore. But Saad and Mark, given what you've heard from the committee members, would you like to take a moment to just speak to what you've heard today, and how will their comments be then recorded and documented into the report? I know you spoke to it at the very beginning, but now that you've heard what the feedback is there something else you'd like to add? And thank you.
Thank you, Chair. Well, first, I think someone said, these are very difficult conversations to have, and I agree, but vitally necessary. And I think that you've provided us with some very impactful examples of the challenges and issues being faced now and well into the future from people with disabilities. I've been taking quite extensive notes, as I know Mark has as well. I'm concerned. I don't want to, parrot back what you've already said far more eloquently than I can. But there are some very common and related issues that I think will present a good opportunity for us to coalesce those. Some of the common issues, meaning not just for people with disabilities, but other groups, have been, of course, housing needs, income supports, funding, what I would consider perhaps social determinants of health, which will have a huge sort of thematic thrust in the report that we're putting together. In addition to that, of course, is the need for an equity and accessibility lens in all manner of policy development, and I think the several related items of having a voice at decision-making tables, to me, connects with the need for data collection, the need for a consistent definition and inclusion of people with disabilities in vulnerable populations across all governments, a lack of visibility and therefore then access for people who are in isolation, and this impacts the gains that have been made. I think was also something that came up. This impacts the isolation impacts food insecurity, clothing provision, home care access. And of course, as I mentioned, the issue of income supports, their longevity, some of the disincentives associated with those supports as they relate to, for example, ODSP. And then I think several people commented on healthcare systems issues and some of the inconsistency and some quite troubling triage examples as well. The piece that you asked, Chair, about beyond what I've already said, some of the points relate to the city, some of the points relate to the province and the feds. There will be a component of our report for sure that will look to senior levels of government to address some of the, I would say, insufficient aspects of how services are delivered by which level of government and how they're funded. I think affordable housing, other certain income supports, long-term care, childcare, public health, paramedics. These are some inconsistent delivery expectations at the municipal level. Yet, I would say that financing or funding has not kept pace over the years, going back to as long ago as about the late 90s, when some of these programs were part of municipal services realignment. And so some of the points you've raised will also get identified in the need for the city and the province to reconcile some of the challenges that are being faced by various populations through the programs and supports I've mentioned. So for those who had points that I didn't specifically call out, as I mentioned earlier, I apologize for that. It's not by any means to ignore or to minimize, but rather just to give you some examples of the threads and connections or related points that I picked up, and I'll have a chance, obviously, to reflect on these notes, talk with my colleagues, and we'll look at our total engagement to come up with findings and recommendations. So again, I want to thank the committee for putting aside the time in such short order to provide what is, as I said, very impactful feedback and input that will be very seriously considered. And through you, Chair, I'd like to thank the committee members. Thank you.
Saad, we also want to convey our thanks to you. We appreciate you coming back to our committee the second time round. I do think that we were able to have the conversation we didn't necessarily have last time, and that's incredibly valuable to all the committee members. I know I will look forward to receiving and reading your report and sharing that same report with the members. For the members, just by way of process, Saad's report is actually going to the city manager, and then the city manager, so the city manager will be receiving Saad's report in September, and then by October, he's going to be coming out with his own set of recommendations on what he's going to be putting before council based on Saad's report, just so you know. So with that, I'd like to move that we actually, no, before I do that, I'd like to move a motion, if I may. The clerk can please put this matter on the screen. The motion is that the Toronto Accessibility Advisory Committee requests the Chief Recovery and Rebuild Officer, in consultation with appropriate city staff, to incorporate the committee's comments and suggestions for recovery and rebuild into the Toronto Office of Recovery and Rebuild report. So essentially taking everything that was just provided and putting it all together and bringing it to the city staff, which Saad has already committed to doing, so thank you again. And the motion is on the screen. If I can get, do you want me to read it again, or I think I've read it? Okay, so if I can get the screen again, all those in favor of the motion? Sorry, folks, you're wonderful. And any opposed? Okay, seeing none, then the motion carries. So we're almost there. You folks are wonderful. We do have one more motion to table, and this motion is to provide a formal excuse to excuse the absence of certain committee members. So I will read this out loud. And the clerk can also put this motion onto the screen as well. That the Toronto Accessibility Advisory Committee excuse the absence of Karima Iwig, Glenn Hark, Jason Michelli. If I can get the screen where I can once again see everybody. All those in favor, please raise your hand if you can to indicate your support. And any opposed? That carries. So thank you very much, folks. That brings us to the end of our meeting. And I wish you folks all a very healthy and safe rest of the month. I know that we will probably not be connecting again until September. Feel free to connect with my office and my staff if you need anything else. And there will probably be other matters that we can continue to speak of offline as well. Okay? Take care. Meeting adjourned. Okay. Bye, folks. And thank you again to Saad and his team. And of course to the city clerks, sorry. All right, take care, everyone.
Thank you.
Okay, be well. Okay.